when I was working with Gay Giles up in Mancat, we often spoke about contemplative psychotherapy, and we influenced my work in addiction groups, and where we used basic mild self-hypnotic techniques, and often memories would come back, and a person would suddenly kick their leg out or raise their arm, almost as if the body really was recalling something, or they would get a pain in the back of the head. Is that what you were talking about, the body recalling? Is that?
Yeah, so the classic things of trauma would be emotional numbness, emotional distance.
The Lifton theory of it.
Yeah. So basically, if you've suffered from trauma and the body remembers that trauma, whilst you could have, you have your children and you would say, I love my children, but internally, you can't feel that. You struggle to feel that. There's an emotional distance and an emotional coldness almost. And what do we know from the intergenerational transmission of addiction? When you take people's histories, for men,
biopsychosocial history.
Yeah, and then so what was your relationship with your father like? Was he abusive? No, but he was very distant.
So then we get into absent father syndrome.
Yeah,
Okay.
He was very cold. He was menacing. Maybe menacing, maybe not. But so because we know for good child development, you need to be nurtured in a warm and loving and safe environment. We know that if it's less than warm and safe environment, then that might be trauma. I mean, the one I always think about from having being brought up where I was brought up in the north of England is it's Friday, it's 5 to 5, it's crackerjack.
Yeah.
But for some people whose fathers had heavy drinking problems, it's Friday, it's 5 to 5, struck them with terror.
Yeah.
Because if your father used to get paid about 4 o'clock in cash, in his wage slip, in the paper mill, if he'd call up via the pub on his way home, and your mum had said he could have an hour, so it's 5 to 5, it's crackerjack. Well, hopefully he's going to come home in the next 5 minutes. If he isn't home at 5, it's 5:15, it's 5:30. Oh no, it's 5:45, it's 6 o'clock. Now what's going to happen next is the click of the garden gate's going to go. It could be that there's fish and chips all around for everybody. It could be a bang round the back of the head, you get to bed now. And for a child, it's not knowing that's traumatic. You shouldn't have that degree of anxiety as a child. And then, of course, what happens over time, you want to get control, paradox of addiction. You lose control in order to gain control. Why? Because when I discover, the young alcoholic, the young addict discovers the power of strong lager or the power of white cider, I'm not bothered if he comes home or not now.
I'm just picking up on that use of alcohol in that way. Professor Verdin, I keep dropping these professors, but these are the guys that actually influenced me and still remain. He told me that alcohol is the only drug he was aware of that we use at different times of our life to create different effects. So we early on we use it as a charge, get us rolling. Later on in life, G&Ts when we get home to relax. And so they've got the same drug on the same person to cause a different effect.
Absolutely.
Yeah.
I remember a guy always used to say to me, when you're young, this is tongue in cheek, but when you're young, there's absolutely no excuse for not taking stimulant drugs. And when you're older, there's no excuse for not taking depressant drugs.